Good evening. My name is Margaret McDonald. Today we are going to be exploring population health in Zambia. I have chosen Zambia as a country to explore in because Zambia is a landlocked country in South Central Africa with 72 tribal languages. Ethnicity is 99% and 1% composition of Europeans, Americans, and Asians. The population of Zambia is 17 million inhabitants. As you can see, 3% 65 years and above. 51% are between 15 to 65 years. 44% of this population live in urban areas and 56% live in the rural areas. COVID-19 pandemic, Zambia. The first two cases of COVID were in Lusaka, and this was a couple who had traveled to France for vacation, and it was on March 18th when they returned to Zambia. They tested them at the port of entry, and the couple tested positive. The couple was put in quarantine for 14 days. And the second case was of a man who traveled to Pakistan, and that was on the 22nd of March when he returned into Zambia. He was also tested at the port of entry, and he tested positive for COVID-19. He was also put in quarantine for 14 days. This is a map of Zambia with different provinces and districts. The district report of cases, this was since Wednesday 20th May. The COVID-19 is spreading here. We have so many high cases. This is how it is affecting the country. If you look up, there is a central concentration of the cases. The northern part has a lot of cases because Zambia shares the border with Tanzania up north, and Tanzanians are moving in and back and forth to the borders because of commodity selling business where they go buy goods for sale. But with the COVID-19, the people from Tanzania, when they cross over into Zambia, they are not practicing social distancing. The central one here is where a lot of economical activities are happening, and there is more people who are not practicing social distancing. As you can see, it says new cases 60. So all these dots here, this is where we have all those cases rising up. If you look, the border is called Nakonde. If you look up on the left, it's Nakonde 456 cases, where they put a plus sign. I think that's also new cases there. So we have Nakonde now as a hotspot for COVID-19 in Zambia. And this is cases by provinces. Like I had shown you the first map, which had different provinces and districts in there. So now this is a version of that map. When you look at this, in here where it's white, it's a western, southern, and eastern provinces, we have 0 cases. When we look at northern, Ruapula, northwestern, and central, no, not central, we have 1 to 25 cases, and in central we have 26 to 50. We come to Lusaka here, we have more than 100 of cases. So this is where we are picking. The testing is the latest in 24 hours. I picked this on the 20th. Healthcare and public health. Hospitals in Zambia are most run by the government and few by the private entities. Also, clinics, they are run by the government through the districts. The pharmaceuticals, this is the only thing I looked up, and this is all run by private entities. I did not find anything that says this is a Zambian government pharmaceuticals. We came to public health institutions. It includes the Tropical Disease Research Center. They have Environmental Council of Zambia and the Department of Health, which is under the provinces. The impacts on vulnerable population. This is due to closures of airports that affected the flow of goods and services, because people in African countries depends on goods merchandising, border crossing, and all that. So they imposed strict measures at the borders, causing congestion in clearing the goods. Closures of school also affected the vulnerable population because they had not they could not access classes online as internet is limited. That includes universities, colleges, elementary, and high school. Lack of PPEs, masks, had an impact on the population because very few had access to them. Restaurants were also ordered to operate only on takeaway and delivery basics. Bars, nightclubs, casinos, and the rest were also closed down. They asked them not to be operating until everything was put in order. US versus Zambia responses. In responding, they have similarities between Zambia and the US. The only thing that Zambia is not doing much on is the vaccine research. But when you look at this slide, I have where I put the Y is a yes, it's similarities, and where I put the no is no. So which means Zambia has one no, but the rest it's a yes. They closed airport, both of them yes, Zambia and US did. And social distancing, yes, Zambia, US practicing that. Mask wearings, all of them in Zambia they're wearing masks, and US are. Testing, they're testing in both ends, and washing of hands, both ends they're washing hands. When we come to vaccine research, US it's yes, is working on vaccine. Zambia is not. When we come on contact tracing, yes, Zambia, US, they're both doing that. Community sensitization on both ends, they're working on, they're doing that, yes. Equity response, In the US, the impact is more on blacks, Hispanic, and the low income, also those in prison and poor communities. This is because of limited access to health care. In Zambia, it is more on the poor community who are low-wage earners and live in underdeveloped communities. It is hard for someone to attain their full health equity due to also not having enough education or having a better job. Actions are needed to end all these disparities. A social determinant, the community where one is born, grow, live, works, and age plays a major role in the COVID-19 pandemic or in our health outcomes. This is because health outcomes depend on where we live, where one lives, grows, and works, or where somebody plays. The environment has to be clean for you to have a good health, and the food you eat also improves the health outcome. Also, the quality of housing someone lives in, the environment conditions. The place has to be upkeep and clean for you to have a good health. But if you live in a house where there is dirty, or the environment outside is dirty, then your health outcome is bad. It's not healthy. The social norms and attitudes, discrimination, racism, and distrust of government. Also, poverty and equal access to health care, lack of education, stigma, and underlying contribution of social determinant of health is one of them. Also, it could be culture, general customs, belief of a particular group of people. Some people don't believe in going to doctors. It's just their culture. And some people will choose to go do you substitute the health care for maybe taking other kinds of remedies instead of going to see the doctor. So this is where culture and beliefs comes in. Also, language and literature, health equity could also be the absence of systematic disparities in health. In conclusion, coronavirus has affected all nations globally, and they are using the same guidelines to combat the pandemic. What can we say about this pandemic? We can say this is a catastrophe outcome from COVID-19 pandemic. How do we handle this? We handle this by continuing to follow the guidelines on social distancing, by wearing masks, by washing hands, and making sure you are wiping your areas and keeping your environment clean. Thank you very much.